Hello, this is from my YouTube channel AI Nexus. I'm going to talk about artificial intelligence. I'm Dr. TV Geeta. In this particular video, we're going to talk about AI for doctors, and especially we are going to talk about ChatGPT for busy doctors, how it can save time and improve your workflow. So, first question is, what is ChatGPT? It is interacts with you in a conversational manner like a chatbot. More importantly, it can remember what you asked before, so that the next question it answers in an intelligent manner. So what can you use it for? You can use it for explanation, to get information, for drafting, for structuring your information. All this it can be used. But it is only a supportive information and writing assistant. It is not a decision maker. Now, why should doctors care about ChatGPT? That's the next question. So, it is a clinical assistant for thinking and writing, but it is not a diagnostic person, or it is not a decision maker. So, here we are looking at best use cases: clinical documentation support, clinical reasoning and generative differential diagnosis for support only, please remember that, and patient communication. So, ChatGPT is a support tool. Again and again, we are emphasizing it is not a clinical decision maker. So how to use? You have to first install. Most of you will have ChatGPT on your phone, but otherwise in iPhone, open app for search for ChatGPT, tap get, open app and sign in. In Android, open Google Play Store, search for ChatGPT, press install, open the app and sign in. Once you open your ChatGPT, you get a message box. So you type a question or request in ChatGPT terms. It's called prompt. We're going to talk about this prompt a lot. This is in the message box. Example: write a concise SOAP note for a patient with hypertension. Follow-up is a type of question you can ask. We'll go into detail about this later. The important thing is you can continue the conversation asking follow-up questions. And you can upload images and ask questions about it, or you can give something and ask it to generate an image for that. Both are possible. Even files, you can do the same. Now, let us look at prompting. This is an important aspect for the use of ChatGPT. If you don't do prompting properly, you won't get any useful information. For example, a very poor prompt is explain chest pain. When you ask this, it will give a lot of vague information which is not useful to you, especially as a doctor. So a better prompt, I'll go more in detail, is explain differential diagnosis of chest pain in a 50-year-old diabetic male in a table format with urgency classification. Please remember this question a little, because you're going to, I have given this to ChatGPT, I've got an answer. Now please remember, if you give the same question, it may give it in a slightly different format. So don't expect the same thing. Last time I got it like this time. That is not how ChatGPT works. So the core principle here is, for prompting for you, is very easy, because you have to think like yourself, prompt like a clinician. So this is the answer I got from ChatGPT when I asked that question, which I told you, 50-year-old male with hyper this thing. This is the answer. It has given the urgency classification. It has given everything. High risk features. It's given why diabetes changes the differential, and initial evaluation typically includes what all, and all that it has given. So a commonly used emergency assessment framework for this type of chest pain is what it is given. This is just to help you. It is not making a decision. It is giving you information to the question you asked. Now, what we're going to do is, we are looking at what is the core principle of prompting in a clinical scenario or context. We'll call it a clinical prompting framework. It consists of 5 components: role, task, patient context, output structure format, and constraints. So what is this role? It is telling AI what it should act as. So as a cardiologist consultant, a primary care physician and neurologist, what do you want ChatGPT to act as? That is, in what perspective you want it to give the answer. Then you have to give clearly the action or the exact task you wanted to do, generate discharge instruction, create a patient-friendly explanation. So patient context is provide the relevant clinical information. For example, like this. So if you see all this clinical information, you know better, you can just read it and see. So you have to give the patient context of relevant patient clinical information. Then you have the output structure format. Whatever you want, like you want in SOAP note, you want bullet points, you want patient friendly language, whatever you want, you can ask. Constraints also, you can use plain language. It is used only for education support. It's not a definitive diagnosis. Avoid medical jargon. All these constraints, whatever constraints you want, you can give. So some other prompts are provide answer in bullet points with headings. Force clinical read. Explain the reasoning step by step and uncertainty risk. So whatever information is likely to have others or uncertainties, ChatGPT will give you that. Ask for red flags. Include red flags where you want urgent action to be taken. This also it will give you. So these are some of the prompts that are surely going to be helpful for you. So we will see you have 5 component: role, tells AI who it is; task, it defines the exact task to be done; patient context, this is very much up to you. You have to give the relevant clinical information. If you don't give it, it won't give you. Then output format, it specified what contents you want, structure and format. We will see how to give the content. This is especially true in the second application we are taking. And constraints, we have already explained that. Now let's take an example of clinical documentation. So clinical documentation, what is the advantage of using ChatGPT? It gives time savings. It gives improved note structure. The structure is very much specified. Better efficiency, reduced administrative burden. Moreover, it will be consistent across teams if you ask them to give these type of prompts. So you can ask it for examples of the note structures. You can ask for SOAP notes. You can ask for discharge summaries. You can ask for referral letters. You can ask for history and physical note. Whatever you want, you can ask. So we are going to take the example of SOAP note. So clinical documentation where we want a SOAP note to be generated. So first you have to ask give the role, act as an internal medical hospital person, documenting an inpatient SOAP progress note. The task is write a SOAP note for today's evaluation. The clinical patient context is quite in detail. It has some specific type of information you have to give. So you can read this. I'm not reading it. You are the expert. So we have given this information, and then you want a full SOAP note with clearly labeled sections. This is what you want. And then the constraints: do not include new findings, maintain patient clinical tone, organize assessment and plan clearly, be concise, and electronic medical record ready. So this is what you want. Now this exact information I gave as query. We don't have time to actually give the query now and get the output. So I will show you the output that was generated by ChatGPT. This is the output. So you have the subjective information, the objective, the vitals and all that. Then the assessment, possible assessment, and what is the plan. So you can read through it slightly, and you can go through it later on also. So this is the output that was given from the ChatGPT. So what is it as a clinician you have to give? You have to give the role. You have to give what is the task. See the patient chief complaints, symptoms, PMH, medication, allergies, vitals. These are generally the context you have to give for most of the applications. Output structure, clearly labeled sections in bullet points and constraints is given. You can even say make it a word limit, and you must make it EHR, electronic health record ready. Flag missing information if needed. If needed, you flag missing information. That is what you are asking ChatGPT to do. So all this information you can ask. Clinical reasoning and differential diagnosis, quick organization of symptoms, these are the advantage. General broad differential diagnosis, supporting structured step-by-step reasoning, guideline-based reasoning, explaining why you have come to that particular diagnostic reasoning, and reduced the misdiagnosis by also giving consideration for less obvious possibilities. So we have taken an example of a query or a prompt. So chest pain triage prompt. So you are an emergency medicine physician. Access possible causes of chest pain and determine the emergency. That's your task. The task you're giving ChatGPT, and you're giving the patient context and the output format. Here, look at the output format. You're asking you to give possible causes ranked, red flags, urgency level, and what are the next steps to be taken. So the content is also what you want and structured what you want. Do not give a definitive diagnosis, prioritize safety, and summarize as bullet points. So I gave this exactly to the ChatGPT, and I got this as output. Possible causes, got it. Rank. You will know whether it's right. Please don't take it as the final word. It is never. It is you who knows what it gives as correct or not. Then this is about the red flags: central chest pain, sweating, nausea, vomiting, risk factors. What are the risk factors and so on. And then the urgency level it is giving you, and what are the probable next steps you want to take. Please take all this information as only a help to you. Okay, an assistant is giving this to you. You have to make the final decision. So this is the output you got. So what did you give? You gave the role, you gave the task, analyze the case and provide clinical reasoning, differential diagnosis, likely diagnosis, recommended next steps, patient context, it is given, an output structure, clinical summary, differential diagnosis, most likely diagnosis, reasoning, recommended evaluation and management, whatever format you want. Constraint, use only provided information, do not invent findings, use concise professional medical language, clearly state the uncertainty when appropriate. All this is all, this is typical you can give in clinical research. Next, we can use ChatGPT for patient communication. This is very important. So it assists healthcare professional. You can even draft patient educational materials, discharge instructions, and so on. It enhances patient understanding, provides 24/7 support, and supports multilingual communication. This is very important in a country like ours, where you, in India, like, or many other countries also, where you have to generate this patient communication in different languages. So diabetes life plan is an example we are using. So you are an endocrinologist, provide lifestyle recommendations for diabetes management. So given the patient context, see here the context is slightly different, so that you have to decide. And output, we want the format. The structure is diet recommendation, exercise plan, and daily habit changes. Summarize and give us bullet points. So this exactly is what I gave to ChatGPT. And you have constraints. Don't give medication advice and use an encouraging tone. So what we had, this was output. Diet recommendations, exercise plan, daily habit changes. This was what ChatGPT gave me. You can read through it. You will see what it gives. And the realistic workflow is a doctor might text prompt with clinical data and ask for information. Use ChatGPT so that you can get a structured SOAP note. Ask for differential analysis, generate patient explanation. You can double check with guidelines also if you want. So it's faster, it's clearer, you'll have less burnout. Safety and ethics are also particularly important. So in no place you should give the patient identifier, and it should never be used for final diagnosis. And you have to clinically verify all information, especially critical information. It is only a support tool and it cannot make decisions. Common mistakes to avoid: don't give too vague prompts like tell me about stroke, such that if you do not provide the proper patient context, it depends on what you're using it for. You know what are the questions you will ask the patient, whatever. So those context should be given specifically. You saw for clinical reasoning how it was different, and for patient communication how the patient context is different. And you cannot expect any diagnosis if you don't give the proper data. And you can refine outputs also. Please do that. If you do not, you may not end up with exactly what you want. It sometimes can hallucinate guidelines, so don't blind trust. What is the hallucination? It can generate guidelines which are false, so don't trust it fully. Using it for final diagnosis is very wrong. That is a mistake because it's not a licensed system. So please remember, ChatGPT can be used to help you as a support tool. You're the person who makes the final decision and gives it the correct data to make use of it properly. So the key takeaways are: it is a thinking partner, it is a writing assistant, it's a translator from medical to patient language and in regional languages like Tamil, Malayalam and so on. And it is not a diagnostic person, it is not a replacement for clinical judgment. So let AI handle the busy work so doctors can concentrate on better healing for the patient. In the next video in AI Nexus, I will be talking about how ChatGPT can empower doctors to research smarter and educate better. So, thank you.